It's time for Pet Files Ask the Vet, underwritten by the Millerton Veterinary Practice. Traditional small animal medicine and surgery, chiropractic, laser therapy, acupuncture, and Chinese herbal medicine. 518-789-3440, millertonvet.com. With us today, Dr. Carolyn Cannon, founder, co-owner of the Millerton Veterinary Practice. Hello, Dr. Cannon.
Hello, Jill Goodman. I'm happy to be here today.
We are so happy to have you. It is always a pleasure.
As for me.
Oh, that's a good way of saying it. Do you remember The Pleasure Is Mine? I like that one, too.
I do.
All right. Lily in New Preston, I adopted my first cat, and she happens to be pregnant. And I'm super spun out from all the conflicting info about feeding her. Wet kitten food comes up a lot, but I'm not clear on why. Supplements? What's the calorie count I'm aiming for per day? Free feed or no? Yeah, I'd be confused. Can you shed some light, please?
Yeah, that's there's a lot of information. I'm sure there's a lot of information out there, a lot of it from personal experience, et cetera, which isn't necessarily scientific. So pregnancy, so hopefully you have some idea, Lily has some idea about how far along she is. If not, your veterinarian can give you an estimate. So the pregnancy in cats lasts for about 63 to 65 days, although it can be a little bit shorter and a little longer, but that's the average. And so we kind of, just like with people, we divide it into about 3 trimesters. So, if you have a cat who has been astray and may be too thin, you have to be concerned. Most commonly, the problems that we see these days are obesity. And so that you have to be a little bit more careful about that. So the fewer kittens, excuse me, that your cat has, the more likely they will be overfed. So keep that in mind. Kitten food is a good idea. Kitten food is higher in nutrition. It's going to have a higher protein and fat content and higher calcium. So the calcium phosphorus ratio has to be a little bit different for the formation of these kitten bones. So the idea behind the kitten food is that they're definitely going to need it in the 3rd trimester, and the mom is definitely going to need it while she's lactating these kittens through all of lactation. So probably the best thing to do is to transition as soon as you have the cat, or as soon as you realize that your cat's pregnant, is to do a gradual transition to kitten food. In my opinion, wet food is better. They're going to get enough water, basically, enough hydration in the wet food. You don't have to worry about hydration as much. It is a food that tends to be less processed, although not always, and definitely will pass through the gut slower, so less inflammation. So the wet food is a good idea, and transition gradually to kitten food. And the reason why you're doing it now is because we don't want to have to transition in that important time when the queen, of course, cats who are pregnant are called queens.
Are they really?
Appropriately so. Aren't all cats queens?
Absolutely. No, but what a perfect, unlike bitch.
Right. It is befitting of the cat.
Right.
So, what we don't want is to have diarrhea from a diet change at the most important time for them to get the calories. So an early transition to kitten food is a good idea. Excuse me. And wet food's a good idea if that you can get them to eat enough of it. So as we all know, some cats are tied to that dry food, crunchy, high carbohydrate stuff, and you can't get them to eat enough wet food, in which case you have to give in and do the dry food. So I don't think that I have a calorie count per se, but the important thing is that your cat is not overweight. Overweight cats will have actually decreased milk production and may have difficult labor. So you want a very slow, steady weight gain through gestation, which is, we're talking about a couple of months. If you underfeed and you have a skinny cat, you can get things like spontaneous abortions and stillbirths, but more importantly, you'll have kittens that are basically low birth weight, and they don't thrive. So failure to thrive is a real thing in puppies and kittens. So you do have to be careful. Use your eyes. You can tell when your cat, and use your veterinarian, you can tell when your cat is certainly most people can tell when their cats look too thin, but you have to be careful about not letting them get overweight as well. So you want a gradually increased weight gain. As your cat gets into the third trimester, you're going to have most of the time lots of kittens in there, and so not a lot of room for eating. So smaller, more frequent meals, maybe 4 times a day, of the canned kitten food would be a good idea. And after she has the kittens, then lactation is even more energy intense. That peak milk production is going to be around a month, 3 or 4 weeks for these kittens. And so some people do free feed at that point. It's hard to free feed with canned food because it kind of, leaving it out, it kind of gets gross.
Scuzzy,
but
right.
Free feeding, meaning, I think, in general, is once they've finished, once mom's coming out of the box, you're keeping her in with the babies, she's nursing them, she'll jump out of the box and eat some more whenever she wants to if you keep that bowl full. So,
or the plate full.
Or the plate, right. And so, that's not a bad idea to free feed during that period of time. But again, if you've only got 1 or 2 kittens, you're going to have an obese cat by the time she's done lactating. So you may have, 4 kittens, 5 kittens, then it's more of a challenge to keep them fed enough calories so that your cat doesn't become malnourished or too thin during lactation.
All right. A couple questions, because this I've never done, like Lily. How long is that period where you would be, how long is the lactation period where you would be feeding extra, potentially?
So they're going to be producing most milk at 3 or 4 weeks of lactation. Most people will wean their kittens 7 or 8 weeks of age.
Okay.
So the weaning process is a little difficult too. But actually, the peak requirement for food is often right around 6 or 8 weeks because the kittens will start to eat some of mom's food. You can purposely start to feed kittens if mom's having a difficult time producing enough milk. You can start to feed them a little kitten food mixed with some milk replacer when they're around 3 or 4 weeks. They'll start to eat some solid food.
And presumably, somewhere along the way, a veterinarian will become a vet will become involved just to speak to, so
and be able to give more specific information. Absolutely,
and
especially for that weaning process,
right?
So because it can be stressful for everybody.
So let's move back to just being the pregnant part, and that was. Are there supplements that you want to do, or do you want to just not?
Not if you're feeding kitten food. You don't need to do it. And in fact, if you're doing supplements, you can unbalance the calcium-phosphorus ratio.
Okay.
So you don't want to do that.
Emphasis on that. All right. That's most informative, and we wish Lily the best of luck with her feline.
With her queen.
With her queen. I think that's just perfect. All right. I think we're still on the topic of cats. Anne in New Milford, my British short-hair cat. What's that?
British short hair?
Yeah.
Beautiful gray cat.
Oh, okay. Has cataracts, and my daughter is pressuring me to investigate surgery since the cataracts are not advanced. My cat is 8, and I suspect it would be more merciful to allow her to go blind and just take extra care of her. Any thoughts you have is appreciated.
The British short hair, along with Himalayan and cats and some of the other purebreds, have a genetic predisposition to cataracts. And but we don't know whether that's caused your cat's cataracts or not. I don't know what the genes do that causes the cataracts. In most cats, cataracts are caused by chronic inflammation inside the eye, most common, or trauma. So there's some sort of traumatic injury. If it's one eye, unlikely trauma. If it's both eyes, you will... but more commonly caused by uveitis, which is inflammation inside the eye. So the uveitis can be caused by all kinds of different diseases. Cataracts can also be caused by diabetes in cats. So we have to talk about, what are the underlying causes if you see a cataract, and your veterinarian needs to work that up a bit so that you can treat the underlying cause and address that first. A cataract is simply, an opacity in the lens. The lens is the sac that's right behind the iris, and it directs light onto the retina so that you can see. And if there's an opacity, then you're interfering with the amount of light coming to the retina, and you can disrupt vision. So the cataracts can advance with age until you get that white appearance that's easy to see. Early cataracts, you can't really see them unless your veterinarian looks with the ophthalmoscope. So regular veterinary care is critical. I tell you, I've gotten calls. I don't know what it is about this past month, but we've gotten calls from several people whose pets have never been to a veterinarian in 8 or 10 years. It's these kinds of things that can be picked up even if it's a once-a-year physical exam, so that preventive medicine can be done.
That is interesting. Do you think that do you have any sense of that? Is it a cost thing or is it a medicine thing?
I don't know. I think maybe we're seeing them more because there's so few veterinarians available in the area. Our usual clientele is, or people come in a lot. So these must be problems maybe that we're seeing more of now because other vet practices aren't being able to see enough clients. I don't know. I have no idea what it is, but it's an interesting phenomenon, and that and certainly cost is a big part of it. Yeah, I'm sure that people afford. You can get a kitten for free anywhere, but the veterinary care is not free.
I know, but you can get a kid for free. I don't mean it like that, but there is an over balance. I'm just going to say balance in all things. So basically, the cat doesn't have to go blind, and the cat doesn't necessarily have to get surgered. What is it for people that you get LASIK? The cat doesn't necessarily need to get, quote, kitty cat LASIK surgery, but what needs to happen, if I was listening properly, is that the underlying condition needs to be...
In most cats, yes. I would say in the British Shorthair, the genetic predisposition probably is not treatable. And so actually the question was about surgery, right? And I didn't address that. So, the best way to treat blindness in a cat with a mature cataract or with cataracts is surgery. And it's called phacoemulsification. So the veterinary ophthalmologist does this surgery, not your general practitioner, and will suck out the lens and put in a new lens, and then you have good vision. The alternative, of course, is to let your cat go blind. A blind cat cannot go outdoors, and a blind cat still has lots of sensory input through the nose and through hearing, and typically will do okay around the house. So most cats that I see that have advanced cataracts are older, and they're 15, 16. So I think that this cat we were talking about was younger.
Cat is 8, and the cataracts are not advanced.
Yeah, so it may be something that I certainly, if this was my cat, would take her to an ophthalmologist and see what could be done, and eventually what might happen, how quickly the cataracts might advance with their experience and knowledge, and how much does surgery cost.
So basically get some information about that before deciding either or.
Yeah, because certainly life quality is better with all your senses. Yeah.
But also certainly at 8, there's no automatic. Doesn't say when you're 8 years and 1 month, then it gets this, and 8 years. It's like everybody's at a different clock, so to speak.
Yeah,
so.
Yeah, and you may have a cat for the next 12 years who can't see versus one who has a better life quality. So it comes down sometimes to what you can afford to do.
So, all right. I think that's a really good answer to a question that wasn't quite asked that way. Mm-hmm. All right. Alec and Bet in Phoenicia, big decisions are coming up concerning our German Shepherd's hip dysplasia. Can you please talk a bit about the pros and cons of hip replacement versus femoral head ostectomy? Both are on the table for Lady Bird. She's 9 years old, and apart from the pain, is in decent health, although she tends to have allergies.
So first, I maybe should explain what hip dysplasia is, and that is that the hips are not perfectly formed. So a hip in a dog, as in a human and a cat, should have a good ball and socket joint. So the ball is on the top of the femur, and the socket is on the pelvis. And they should be round and they should be smooth, and they should have a nice cushion of cartilage. And when you have dysplasia, that means that they're not perfectly formed, and so the ball and socket don't rotate beautifully. So you get lots of micro trauma in there and pain, and then the body tries to stabilize that hip because it's loose and lays down lots of calcium, and it becomes a big painful mess. So you get arthritis with that and pain. So what was done in the past before a total hip replacement was available was femoral head ostectomy, meaning that the femur, of course, is the leg bone, and the head of the femur, which includes the neck and the ball of the femur, is just chopped off. The surgery removes the head of the femur and smooths it out, and there are different ways of helping with basically you're hoping to form a false socket in the soft tissue because you don't want bone on bone. That causes pain. So over time, if this is closed up properly, then the rotation of the end of the femur bone causes scar tissue to form in a sort of a false socket there. So you can get weight bearing without pain. There are, problems with that, lots of problems with that because you effectively have a little bit shorter leg. And so all kinds of lumbar problems and back problems can come along. But with the proper, if you have a dog who's lightweight and you have the proper rehab therapy, then, dogs can do quite well, especially a 9-year-old dog. The smaller the dog, the better they do with ostectomy. So a German Shepherd, I think that I don't have a feel for this dog's, certainly age is 9, but I don't have a feel for size and weight. So if you've got kind of a smallish female, and your veterinarian can help you with this. If you've got a smallish female and the other hip is not in really bad shape, and she is not overweight, then you might get and you're able to do some rehab therapy. Then you might get away with good success, fair success with an ostectomy for the rest of her life. Of course, the treatment of choice would be hip replacement. Nowadays, the problems that can arise are much fewer than they were 20 years ago. So hip replacement's done frequently. Again, it's going to be much, much more expensive than an ostectomy. So a lot of times the difference will be whether you can afford it or whether you have insurance, which can be a great thing. Catastrophic, these kinds of problems can be covered with the right kind of insurance. And I tell people when they ask me is that, get it, if you don't think that you can afford, a $10,000 or $12,000 surgery at the drop of a hat, then getting insurance just for that kind of thing, not for your regular checkups, may be the thing to do, but you want to get insurance when they're babies before they have any problems.
All right, and let's just pretend for 1 second that there's unlimited funds, and it's whatever's best for Lady Bird. And
so if she's in decent health, then and it can be afforded, that even the replacement of one hip would give her a much better quality of life. So the part that's replaced is the ball and the socket. The ball is often made of metal, and the socket with some dense plastic, and they're held in place. I actually don't know exactly how they're held in place. Many with a cement, and so they've worked out a lot of the complications that come along with this surgery, except for the cost of it, of course. And I can't quote you a cost, but something that could easily be obtained by calling around a bit.
But basically, long short, if everything's on the table, just in terms, if it's simply a question of procedure, if you're just black and white, this procedure or that procedure, much likely better outcome with the full hip replacement.
In my opinion, yes.
Okay. All right. I think we've got one more question, and this is name and town withheld. I don't think we've ever had name and town withheld. Thank you for this name and town withheld. I plan to adopt when we see the question, okay. I plan to adopt a kitten later this year. Where I live, there's a local org that rescues feral cats off the streets and finds them home. The woman who runs it lives in my building, and to be honest, there's a lot of pressure coming from her to adopt from her. But I am worried that a feral kitty might be prone to worse health than one from an ordinary rescue, considering that the mama and papa probably didn't get good nutrition, pollution in their environment, etc. As a vet, what's your honest take? Therefore, name and time withheld.
So first, I have to address what we're talking about here. So a feral cat versus a stray cat. So a stray cat is a cat that has likely been socialized as a kitten and maybe lived with somebody, or is used to people and not scared of people, not afraid of people and everything that has to do with people. A feral cat was raised without human contact, and so can live in the wild, perhaps with some subsidy of cat food by humans, but is doing most of the hunting itself and has great fear of human beings. So feral cats are very difficult to find homes for and to place in homes. So I'm not sure whether we're talking about ferals or not. A stray cat eventually probably will approach a person to be touched. If it might take them a while to get used to the person because they have been living on the streets. But eventually, when they're brought into the house, they very often will come around and remember that life is good and will start to get fat and happy. A feral cat brought into the house is a dangerous thing. If they're cornered, they will hurt people. And so if we're talking about adopting feral kittens, that is a possibility. The problems with that are many. They have to be taken away, of course, from the feral colony at a young age, and so it's not, they can learn a lot even in 2 weeks, but taken away at 2 or 3 weeks can be difficult with their socializing in general, and it can take some time to socialize them. So typically people who do that know how to do it, and then they'll raise the kittens to 7 or 8 weeks, and they will be socialized before they're adopted. So not sure how to answer this question. I would not adopt a feral cat.
But you would adopt a stray kitten, and I'm going to jump in here for 2 reasons. One is we are almost out of time, and 2, I can't help myself, and 3, I think that the most valuable piece of information in this, just the way that the question is phrased, is that it's a stray cat, not a feral cat. Because it doesn't.
So a stray cat, many of them are being fed. They probably don't have as good nutrition, but I think that there's a great need for adopting kittens from stray animals and taking them in, or adopting a stray cat who can be a sweetheart. So if you're very worried about the health, that you don't have the means to take care of a cat that might have some health problems, then I would be careful about that. But if you can take your cat to the vet and get them dewormed and get them spayed and neutered, the general health, unless this cat is super, super, super thin, the general health is probably not that different.
But given that the rescuer essentially lives in the building, is the upstairs neighbor, I think that you also, you do have eyes on. This isn't not like some random person in the woods.
Right. So find out what the details are is what I would do, is find out what the details are. But I'm not too worried about adoption of a stray cat if the rescue is making sure that they don't have parasites and making sure they're vaccinated and, holding on to them for a couple of weeks before they're let out, because you don't want to adopt out a cat who has got rabies. If a cat has rabies, they're going to show symptoms within 2 weeks. Okay,
that's good news. But yeah, I just like just generally, I think it's a good T-shirt. You don't want to adopt a cat with rabies. That's good.
Right, that's probably not a good idea.
All right.
But it is a wonderful thing to take an astray if you can. Yep. If it's nice and can be is properly socialized, so can be a house cat that's not going to be hiding under your bed for the next 6 years.
Right, and they are grateful, and you are grateful, and it ends up, in many cases, having done it, being a really wonderful thing for all parties. All right.
Right.
As usual, thank you so much, Dr. Cannon.
Thank you for the great questions.
This has been Pet Files Ask the Vet, underwritten by the Millerton Veterinary Practice, 518-789-3440, millertonvet.com.